Away from real estate, ladies and gentlemen, there is a lot of misinformation about cancer out there. In light of cancer awareness, join us today with Dr. Baig as we discuss further about these myths. Hi, Dr. Mustafa.
Hi, Soma. How are you?
I'm very well. How are you doing?
Very good, very good.
So this is a lovely clinic. Can
Thank you.
please introduce our client? Where is it located? What is it about?
Okay, so this clinic is called Rehan Healthcare. All right, my name is Dr. Mustafa Baig. I'm a consultant radiologist practicing for the past 5 years. Currently, I'm based here at Rehan Healthcare, which is located just opposite Aga Khan Hospital in Third Parklands. We are in a building called Park Medical Center. We're on first floor. Breast Cancer Awareness Month has just passed. And through Rehan Healthcare, we have screening programs going on for breast cancer and prostate cancer. Yeah, we do have a breast ultrasound machine, yeah, breast mammogram machines, which are the core technologies that are used for detecting breast cancers. Okay, I myself am a consultant radiologist, so I do also ultrasound guided breast biopsies. Once a lesion is detected on one of the modalities, ultrasound or mammogram, the next step would be to go for a breast biopsy to confirm the diagnosis. This month, yeah, we have a breast cancer screening initiative. We have subsidized rates for everything, and we welcome everyone.
We will showcase it for sure.
Yes.
Lovely.
Yes. Yeah.
So I believe we are going through points by points, and obviously you are the expert. You're going to tell me which one is the truth and which one is not true, and how many percent are they true or false, and if they're true, how can you prevent it?
Yes, there are a lot of myths associated with breast cancer and prostate cancer. So today maybe we can go over some myths and false beliefs.
So Dr. Mustafa,
Yes.
For the first point, I have if you maintain a healthy weight, exercise regularly, eat healthy and limit alcohol, you don't have to worry about breast cancer. How much is that true?
Well, that is not true at all. Okay, breast cancer can affect anyone and everyone. We have world-class athletes also who suffer from breast cancer. Yeah, so it's not correct that if you have a healthy lifestyle, you exercise regularly, that you will not get breast cancer. Correct. You still stand a chance of getting breast cancer, but this is significantly reduced with a healthy exercise, healthy diet, yeah, limiting alcohol, also cigarette smoking. Okay. These are factors which will increase the risk of cancer. Yeah, as you grow older, yeah, the chances of breast cancer tend to increase.
Correct. The second point is if you don't have a family history of breast cancer, you will not get it. You know, usually when you go for checkup,
yes,
usually doctors ask you, do you have in your family and stuff? So,
well, this is not entirely true. Okay. In fact, if we look at the percentages, yeah, 75% of the breast cancers that are detected do not have any family history.
Wow, 75%.
Yes. So only 25% of the breast cancers that are detected are in women, history, who have a family history.
Only in women, not in men.
Men also suffer, but usually it's not related to family history. Yeah.
As the third point I have here, wearing a bra can cause breast cancer, which I really doubt it, to be honest.
This is a false belief. Yeah, totally false belief. The only thing that should be of concern, which is really a very minimal thing, is that bras that contain a wire, yeah, tend to irritate the skin. Okay. And once you get skin irritation, you become prone to infections and developing breast abscesses. Yeah.
As the fourth point,
yes,
it's very interesting. Using underarm deodorant can cause breast cancer. Please say no.
This is a good one, and many women face these challenges or have these myths. Okay, the first point would be this is a false belief, okay, because they till date there are no proven studies, yeah, to show that antiperspirants or deodorants have are linked directly to the cause of breast cancer. However, there are some theories, yeah, that say deodorants containing parabens, yeah, or aluminum products, yeah, tend to have increased estrogen activity in the body. They tend to increase the estrogen activity in the body, which may directly increase the risk of breast cancer. But this is very
Just
minimal,
theory as
yeah,
well.
and
It's
these
not
are
even
just theories.
proven,
There's
yeah.
nothing been proven. So, yes.
This is a really scary one. Finding a lump in your breast means you have cancer.
This is a false belief.
Oh, wow.
Yeah, many women have breast lumps. Yeah,
And do they know that or they don't?
yes, many women know that.
Okay.
Yeah, and most of these breast lumps are benign, meaning they are not cancerous. Okay. However, the point should be that if you do have a breast lump, then you need to go and see your physician and do the necessary investigations recommended by him.
Correct. And how often do you have to do general checkup?
So, it is recommended that after the age of 40 years, you should undergo a routine mammogram. Yeah. So, every annual screening of the mammogram should be done after the age of 40 years.
Yes.
Yeah.
So this question is exactly relevant to your clinic.
Yes.
So mammogram can cause increase of a cancer.
That's
That's what
not
exactly
true.
what your clinic do.
Yes, yes. This is what we do, and this is totally false. Yes, mammograms do have X-ray radiation, but the dose is very, very low. Yeah, and it's not harmful at all. I mean, the risk versus benefit ratio, the benefit ratio is much higher than the risk. Yeah, so I mean, women undergo mammograms every year after the age of 40 years till about 65 years, and there are no studies that have been shown till date that mammograms have directly increased the risk of cancer or can have caused.
Spreading as well.
Yes,
Yeah.
yes, yes.
But then X-ray by itself can cause breast cancer?
Yes, there are different types of X-rays. There's the general X-ray, there's the CT scan. Yeah, when you go to higher doses of X-ray, that can cause increased risk of any cancer, not just breast cancer.
Any kind of
cancer, especially when you're doing something like CT scans, which is a high radiation exposure. Yeah.
Wow. I guess the last point is the question that people are not informed about it. Men do not get breast cancer.
This is not true as well. Yeah, there is a very small percentage. You can say about less than 1%. Yeah,
Less than
chances.
1% chances of men getting it.
Yes, yes,
Wow.
yes. So men can still get breast cancer, and it usually presents around the nipple, yeah, as a hard mass or a lesion. And it is recommended that also men do self breast examinations, and in case they see any changes, they can immediately visit their physicians. Yeah, women tend to have a higher percentage, and you can
Sadly.
yeah, sadly.
What is the percentage for women?
You can say that above the age of 60 years, yeah, there is 1 in 28 women who will develop breast cancer. So this is
1 in 28 women.
yeah, this is very high, and that's why we recommend routine screening in women in the elder postmenopausal women especially. Yes.
When you start your menopause, the chance of getting breast cancer is higher.
It's higher. Yes,
Wow.
it's higher.
Okay.
Yeah, yeah, yeah. And as you grow older till about the age of 65, 70, the chances are higher. Then the chances start going down.
So under the prostate cancer,
Right.
the first point, we have only elderly men get it.
That's totally false. Yeah. It can affect any man above the age of 40 years. Okay.
Above the age of 40 years,
Yes.
correct?
Yes. And what it is that if you have a family history, then there is a stronger chance you will get. But this is not also entirely true. Yeah. Men with unhealthy lifestyles. Yeah. Increased alcohol intake, increased sugar intake or carbohydrate intake, yeah, smoking, yeah, increased consumption of red meat, yeah, all these are factors that have been linked to prostate cancer.
On the third point, I have a very interesting question, which personally I don't have information about it as well.
Right.
What is PSA and what is PSA testing, and how is it connected to prostate gland as well?
Okay, so first of all, we talk about the prostate gland. The prostate gland is a gland located just below the urinary bladder, yeah, and in front of the rectum. It's a small gland that produces secretions, yeah, throughout the lifetime of a male person, yeah, which are the secretions that are secreted within the semen, yeah. So PSA is actually, it stands for something called prostate specific antigen. Okay, this is also a protein secreted by the prostate gland. Yeah, and many times it is secreted by the prostate gland at certain levels, and when these levels increase, yeah, you start suspecting prostate cancer. Yes. So, but this is it's the levels can also increase due to other reasons. Yeah. Sometimes you can have a prostate infection, what we call a prostatitis. Yeah, which may cause increase of the prostate PSA or prostate specific antigen. So PSA is used in the routine screening for prostate cancer. So when you have increased levels of PSA, you need to investigate further on what is causing the increased levels.
So definitely PSA test is very beneficial, right?
Yes, yes. Yeah, and
currently
we are offering it here at Rehan at a
Okay.
very subsidized rate, so
Correct.
you can come.
And how often do you recommend that the test has to be done?
Again, this is after the age of about 45 to 50 years. It should be done annually.
Annually.
Yeah, yeah,
Correct.
yeah.
So as this point, which is very interesting, mentioned that if you don't have any symptom, you don't have any prostate cancer.
This is false. Okay, what we need to know is that in the beginning stages, prostate cancer is asymptomatic, meaning you will not have any symptoms. That's why we recommend routine screening, yeah, like PSA tests and prostate ultrasounds, yeah, and also routine visits to your physician.
Correct.
Yes.
So
yes.
it has no symptom at all.
No symptoms in the beginning. Yeah.
And
however, when the cancer has advanced, yeah, you will have some symptoms like increased frequency of urination. Yeah. When you go to empty your bladder, you feel that you've not emptied your bladder completely. You might even have urinary incontinence. Yeah. You might even have erectile dysfunction.
Oh, wow.
Yeah.
But once the cancer is advanced,
That is
that's
when
where
it's
you will
advanced.
feel it.
Yes.
It's a
yes.
bit late.
Yes, it's a bit late. So we need to detect the prostate cancers early. Yeah. Yes.
Correct.
Yes.
As a last point in prostate cancer, we have prostate cancer surgery will end your sex life.
This is not true. Yeah. There are surgeries that are performed these days, yeah, using laser and robotic surgery as well, yeah, where the nerves which are responsible for the erection, yeah, they are preserved. However, when you have cancers that are advanced, then in those cases it may be difficult, to preserve the function, and you can have erectile dysfunction and urinary incontinence, another thing to note is that immediately post surgery, you may develop erectile dysfunction and urinary incontinence, but most people improve over a period of 1 year. They get better and better, and most people get back to normal routine lives.
But there's a small percentage that they don't.
Yes, there's a small percentage that will not go back to yes.
So,
Yes.
as somebody that is expert in it, has a clinic and everything, what is your advice for our audience?
My only advice is that these are things that these are cancers that we don't know how they come about. There's a lot of speculations and a lot of theories behind it. So my advice is that look after yourself, eat healthy, exercise regularly, limit the use of alcohol, limit the use of cigarette smoking and other intoxicants, and you should be fine,
Okay. And come and check your clinic whenever they need to do
Yes,
checkup.
yes. If you want to come for a routine screening, you're most welcome. Especially this month of November, we have extended our offer for prostate and breast cancer screening. So you're more than welcome.
Thank you. Thank you so much. It was great, and I hope our audience can benefit from it as well.
I hope so too.
It was great
Thank you so
meeting
much.
you.
Thank you for having me.
Thank you.
Yeah.